Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 compression fractures occur every year in the U.S. Most actually go unnoticed because they don't have pain. 50% of women and 25% of men will have an osteoporotic fracture during life, and once a vertebral compression fracture occurs, the risk of an additional fracture goes up fivefold. Typically, symptoms include sudden onset of back pain that gets worse while standing or walking, limited spinal mobility, height loss, deformity, or disability. Now here's a downward spiral. You get a spinal fracture, you start to have some back pain, and then some deformity, kind of hunched forward. It decreases your lung capacity, impairs your function, you start to lose your appetite because you're pinching on the stomach, starts to affect sleeping. Decreased activity overall leads to more bone loss with osteoporosis, increases your fracture risk, and then you get increased lung problems, comorbidities. All in all, it adds up to a 23% increased mortality rate. Treatment options when you have a symptomatic compression fracture may include benign neglect. It hurts, but not that much, doesn't really need treatment, so you just kind of watch it. Medication management may include over-the-counter pain medications such as anti-inflammatories and Tylenol, possibly some narcotics, and then muscle relaxers, because a lot of times spasms are present. Spinal bracing such as this is called a Jewett brace, Jewett. You have 3 points of compression up your chest, abdomen, and then in the back, helps to relieve pain. The vertebroplasty procedure was invented in the 1980s for treatment of fractures due to cancer. Eventually, over a decade later, it was started to be used for regular osteoporotic fractures because the results were so good. It's an outpatient, low-risk procedure that provides instant pain relief. The kyphoplasty procedure was an evolution of vertebroplasty. It became FDA cleared back in 1998, but its popularity increased tremendously 5 years after that. It's similar to a vertebroplasty because it uses bone cement, but involves this placement of a balloon first. Here are the steps. So the pain management doctor will insert a catheter into the fracture around the spinal cord. Okay, it just goes to this bone called the pedicle. Once it's in, the bone balloon is inflated with saline, and this has some dye in it so the pain doctor can see it, and you see how it's compressed here, and then you have the height being restored with the balloon. Now, once that's done, the balloon is removed, and in this void, you have bone cement being filled at very slow pressure, and then the procedure is complete. The bone cement hardens in about 20 minutes. The outcomes are often immediate pain relief from the stabilization. It's almost like an internal splint, with the cement. The aches and spasms can continue for weeks, but most of the pain resolves right away. Over 90% of patients see a dramatic pain relief right away with significant increased function, including walking and performing activities of daily living. Usually this can be performed as an outpatient. The person goes home within a few hours afterwards. There have been studies showing some questionable benefit of the procedures. They are far outnumbered by the ones showing incredible pain relief. The top non-operative pain management in the Dallas-Fort Worth Metroplex is through the TEX-PAIN Network. There are several clinics in the area accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.